You've heard a lot about our vision and about our portfolio. I would now like to ask Suneet Varma to come up and present to you how we will potentially bring these great and breakthrough therapies to patients commercially. Suneet has been a commercial leader at Pfizer and before that at Wyeth for a total of nearly 30 years. He held a number of leadership positions before joining oncology, including global president of rare disease and also global president of the hospital unit. So thank you, Suneet.
Okay, everybody with us still? Good, good, good. On the last session before we go to the second Q&A panel. Thank you, Chris, for that warm introduction. And let me begin by talking about the patients that we served. Last year, we reached over 2 million cancer patients across Pfizer's innovative oncology portfolio and our sterile injectables portfolio, including the cytotoxics in our hospital unit. Of those 2+ million patients, 1 million were treated through our core innovative oncology unit, just to put that number in perspective. And as you all know, Pfizer's greater purpose is breakthroughs that change patients' lives. And simply put, our financial performance is a natural byproduct of the patients we plan to serve. And I'm pleased to say that since close of the Seagen transaction, as you all know was in mid-December, we have integrated our two companies fully into one new Pfizer oncology commercial organization, which is now operational, fully operational. And as you also know, but I'll reinforce what Chris had said earlier, we have taken a best of both approach to design our organization, to select the talent at the leadership level and throughout, and also to preserve key capabilities and enhance capabilities in several cases. Our commercial workforce is now a ratio of 60-40, legacy Pfizer, legacy Seagen, with a bi-coastal presence and innovative sites across the United States. And as Chris mentioned, we have a presence in over 100 countries, which I will talk about later. Further, we have organized our sales and marketing teams by tumor type, and this really allows us to focus sharply on each vertical and maximize our collective expertise, our relationships, and our reach. A perfect example of this was our ability to quickly cross-train hundreds of Ibrance and Tukysa field-based colleagues, doubling our share of voice in HR-positive breast cancer. So in other words, we took our Ibrance reps from legacy Pfizer, trained them on Tukysa, boom, they're out in the market. We did the same with legacy Seagen. Tukysa reps, trained them on Ibrance, boom, they're out in the market. 100% complete operational. And we did that in hematology as well. As Chris showed earlier, we are proud of what we have achieved in Pfizer Oncology over the last 10 years, growing revenue at a rate twice that of the worldwide oncology pharmaceutical market. And this is owing, obviously, to leading therapies that we have, including Ibrance, which is a flagship and a pillar of our portfolio. And this means that as we go forward, we are going to build on that foundation of success. Success, which includes the talented colleagues with the deep knowledge and expertise in oncology, super important feature of being successful in a specialized area like oncology. But we also got to take advantage of our vast geographic footprint and our commercial infrastructure to go to market and continue to drive leadership. We expect continued strong sales and profit growth in oncology through the end of this decade, through 2030. And in the next few slides, I will show you the composition of what comprises that anticipated growth. And as you know, we do anticipate the US patent expiry for Ibrance and Xtandi in 2027, and so we factor that in. And despite those LOEs, as you've heard today, we still aim to double the number of patients treated through our innovative oncology medicines in our portfolio by 2030. We believe this achievement will be possible due to the expected advancement of our innovative R&D pipeline. And by the way, that's why we spent a lot of time on that today, and that's why we're having this Innovation Day, so you really have an appreciation of all the things that we're doing. And that is part of the story. However, we also have ongoing additional innovation for our currently approved products. So those two together are what drive our aspirations for 2030. As you can see on this slide, as we look to 2030, we expect that 2/3 of our projected risk-adjusted revenue will come from new molecular entities, new indications for existing products, and new data currently being generated by R&D. This will certainly impact from this year, 2024, and beyond. That means our current inline portfolio, which includes products on the market today and any new indications that were approved by the end of 2023, that represents the balance 1/3 about of our 2030 risk-adjusted revenue. Likewise, as we grow, we are driving meaningful shifts in the makeup of our portfolio. While today, small molecules comprise the vast majority of our commercial portfolio, by 2030, we plan to increasingly rely on revenues generated by complex biologics, including ADCs and bispecifics and some of the other products you heard about today in our pipeline. Biologics represent a more durable revenue potential based on a number of factors, including differentiated access and affordability to the patient, IRA considerations, and patent expiration timelines, specifically exclusivities, which are statutory versus what is natural in hard-to-make complex biologics. This planned shift to biologics as the main source of revenue is expected to support the accelerated growth of both our top and bottom line. When we look at our portfolio by tumor type, we also see other shifts. As you heard today, breast remains important, but it is expected to represent a smaller portion of our 2030 risk-adjusted revenue due to the expected loss of exclusivity for Ibrance. This will be partially offset by our follow-on new assets in breast in the time frame that we're talking about. Our GU portfolio, comprised of bladder and prostate cancer, is expected to become our largest franchise. This is driven by Padcev, but it is also driven by our prostate cancer portfolio, especially in the US. Earlier today, you also heard about hematology. This was previously more nascent within Pfizer. Long history, but a smaller franchise overall. This will become more prominent right now, starting with the addition of Etcetras and the expected growth of Elrexfio through potential new data and new indications. And I should say, those new indications will be in earlier lines of use with larger patient populations, as Chris defined, and those larger patient populations in earlier use also lead to longer durations of therapy. DCE is our smallest indication. That's where we're starting. But what's coming is much bigger and better. Lastly, thoracic is anticipated to expand with breakthroughs in lung. And this has the potential to scale up and become its own standalone franchise at Pfizer in the future. So we are moving from relying heavily on breast cancer as the main source of revenues in 23 to a more risk-balanced portfolio in 2030. Clearly, there's a lot to be excited about between now and 2030. That being said, we're highly focused on the here and now, especially me and our commercial organization, especially our medical and the rest of our go-to-market organization. We are focused on the here and now, especially launches that are virtually upon us. In our near term, we look at a 3-year horizon. And let me highlight a few programs that have great potential to become significant growth drivers. For example, as you heard today in breast, we believe that vepdegestrant and atirmociclib have the potential to replace the current standards of care, respectively, for HR-positive breast cancer. This is, of course, subject to positive clinical readouts and regulatory approval. In heme, we have a robust ongoing development program for Elrexfio, which you heard about also earlier today. If successful, this will enable us to potentially reach a significant portion of over 50,000 addressable patients across the treatment spectrum for multiple myeloma in the US alone, with the next potential jump up in eligibility coming from double-class exposed, or DCE, relapse refractory, which adds 18,000 eligible patients in the US if approved. Today, TCE with the fifth line plus in the US is about 2,000 patients. So just to give you an order of magnitude, 2 to 18, add 33, 2 to 50K by the time you're done. In prostate, the TALAPRO-3 study, if successful, has the potential to move PARP inhibitors into earlier utilization in the patient journey, significantly expanding the reach of Talzenna plus Xtandi. And finally, in bladder cancer, we believe that disitamab vedotin and sasanlimab have the potential to further solidify our expected leadership in this tumor area in GU, subject to approval. Beyond our strong and differentiated pipeline, we also have a healthy and vibrant inline portfolio. This is that other third, and that underpins our current and future opportunities. And in 2024, the year that we're in now, we expect our 25 medicines and biosimilars. We are focused on the top 10 priority brands that represent 80%, nearly 80% of our revenue. And let me speak to about a half a dozen or so of these top brands, just to give you a sense, like let's say some brief thumbnails of what's exciting us about that. So you can be excited about 2030. We're very excited about 24 to 26, the 3-year, but what are we talking about that we're excited about right now in this particular year? Let me start with Ibrance, which as I stated earlier, is a major contributor of our revenue, however, but faces ongoing challenges from competitive headwinds. We all know that. However, we continue to fortify the base with ongoing data reinforcing the body of evidence and clinical value of Ibrance. There are years of experience and hundreds of thousands of patients that have been treated out there. And we intend Ibrance to remain a foundational pillar of our portfolio as our other products increase in prominence and increase in growth. Our bladder cancer portfolio is anchored by Padcev, what we believe is essentially the new standard of care in locally advanced or metastatic urothelial cancer. 2023 versus 2022, on the Seagen side, we saw more than 60+% revenue growth year over year. And what particularly excites us is that 70% of that came from the community, something Chris touched upon earlier. We are poised to expand Padcev's leadership in urothelial cancer with potentially double the eligible patient population for the combination of Padcev and Keytruda as first-line therapy for locally advanced or metastatic urothelial cancer. Xtandi. It is well established as the standard of care, and it is the branded market leader in prostate cancer. We are especially excited to expand the leadership of Xtandi following the approval late last year in patients with non-metastatic castration-sensitive prostate cancer with biochemical recurrence at high risk for metastasis, representing a potential paradigm shift by offering patients a new treatment option in the earlier setting. Talzenna. We are encouraged by our results to date for Talzenna, where we have seen our US sales rate double in the second half of 2023 versus what we had seen in the first half of 2023. And we're excited for the upcoming global launches, where Talzenna plus Xtandi has now received approval in several key markets, including in Europe, for use in metastatic castration-resistant prostate cancers patients with or without HRR gene mutations. So essentially, as it was pointed out earlier, in Europe, in an all-comers population. We are also preparing for the potential launch in earlier metastatic castration-sensitive prostate cancer in 2026 if our TALAPRO-3 study is also successful. For Elrexfio, this is just the start of something great. It's a very good product, as you saw from Chris, and it is poised to potentially become a new standard of care in multiple myeloma. I am happy to report that since we shared, and this is pretty fresh, you all know this probably, our 17+ month PFS data at ASH in mid-December, so that's pretty new to the marketplace, Elrexfio utilization has meaningfully accelerated in the United States. And we're looking forward to sharing even more updated median overall survival data from the Magnetism 3 study later this year. Etcetris has been remarkably resilient, continuing to rally on its 6-year OS data and grow in 2023, even post-SWOG. It remains the only innovative treatment for Hodgkin's disease with NCCN Category 1 preferred status for those aged 60 and under. And we're also extremely pleased with the performance of Lorbrena, which continued its double-digit growth rate in 2023. Globally last year, also more than 60+%, same number pretty much as Padcev on the Seagen side. Looking ahead, we eagerly await potentially practice-changing data from the CROWN trial this year, which could demonstrate outcomes exceeding those historically reported in patients with non-small cell lung cancer harboring an ALK translocation. As you can see from this slide, we have built a strong go-to-market engine to deliver on both our inline and our pipeline aspirations, and we are preparing the market for all of these launches, NMEs, new indications, new data. We believe our significantly expanded scale, infrastructure, and commercial and medical go-to-market capabilities position us for the success to which we aspire. Our new US customer-facing footprint is nearly triple that of legacy Seagen alone, and it is 50% larger than of legacy Pfizer alone. Actually, I just came back from the West Coast. We had our year beginning meeting, which was the first combined sales and marketing meeting for both legacy Pfizer and legacy Seagen in the new Pfizer Oncology, and it was fantastic. Couldn't have hoped it could be any better. The oncology cultural match between the two companies is indistinguishable between the two organizations, and everyone is extremely focused on this advantage, competitive advantage that we're creating. Through our field colleague cross-training initiatives, we expect to see and are already seeing a significant increase in the share of voice and promotion for those select inline products. And as we think about launch excellence and we plan to leverage Pfizer's global operations, we can commercialize new unpartnered products such as some of the ones you saw today in 5 times the number of countries that legacy Seagen could have done alone. Of course, while we operate as an integrated oncology unit within Pfizer, we still have the benefit of a large-scale, let's say, access to platforms and capabilities across the broader Pfizer enterprise, and that is a big advantage for us to drive performance. For example, we have a new chief marketing office, and this is focused on driving higher ROIs on our sales and marketing investments. It also has allowed us to add additional data analytic capacity. More products, more data, more analytics. And in addition, we have a dedicated access and value only for oncology group and an integrated medical affairs organization that is a part of our Pfizer oncology team. This allows close alignment between clinical development, medical affairs, and commercial execution. So upstream R&D, downstream go-to-market in one place. All of these organizations, therefore, are able to scale and share capabilities and learnings and their respective communities of practice across the Pfizer enterprise. In conclusion, to deliver on our bold vision and position us for continued success, the Pfizer Oncology Commercial Organization is laser focused on 3 core priorities or guiding principles, let's say. First and foremost is preserving our talent and enhancing our capabilities. With the combination of colleagues from legacy Pfizer and Seagen, we believe our oncology expertise is unmatched in the industry, and this is a case clearly where 1 + 1 equals more than 2. Next, we have to ensure business continuity and operate as a newly integrated company, which we're already doing, and we're minimizing distractions and disruptions so that our colleagues can prioritize and deliver on the needs of patients and customers. And finally, we have an unwavering focus on elevating our go-to-market capability to capitalize on our multiple near-term commercial catalysts. Francesca said something earlier today which I always liked, which is a catalyst-rich time in our existence. Thank you so much, and I'll now turn it over back to Chris for the second Q&A portion. Chris?
Thank you, Sunit.